Welcome to Tampa Home Talk with your host, native Tampa real estate girl, Katrina Madewell, a full-time, passionate, out-of-the-box thinker, love for home ownership kind of realtor with over 21 years of combined mortgage and real estate experience. Tune in every week at this time for expert advice on everything you need to know about home ownership, finance, maintaining great credit, building wealth, and making your everyday life better, and how you can be financially successful today and tomorrow. Remember, love where you live or let Katrina fix it. Now, here's your host of Tampa Home Talk, Katrina Madewell.
Hey, good afternoon. Thank you so much for joining us today on Tampa Home Talk. I'm your host, Katrina Madewell. We're happy to have you on the show. If it's the first time you're ever joining us, stick around because we have a great show lined up today. We got some amazing information for you that I think will help you, and it's right on time before we get through the month of October. So our segment and our show today is all about breast cancer awareness because October is Breast Cancer Awareness Month. Just in case you didn't notice the pink everywhere. Even the NFL, you see all kinds of pink creeping up into their thing. They've now have the breast cancer awareness ribbon, even on the field, and all kinds of really stuff. I love that this is coming into play. And so my guests today are going to help me understand more about it and give us a bunch of information, give the person listening all kinds of information that hopefully one day maybe can even save your life or somebody you know. So without further ado, I'd love to introduce our guest for the show. We have Dr. Ambay. He's with Florida Hospital. Jen McVan, also with Florida Hospital. And then we have Michelle Hall. She is a breast cancer survivor, also a patient of Dr. Ambay, and she was so gracious to come in and share her story today. Welcome to the show, you guys.
Well, thank you very much, Katrina. I'm so pleased to be here today.
So tell me a little bit more about what you do, Dr. Ambay. Like, are you specifically just breast cancer treatment? Like, I'm sure there's a technical term for that. I'm totally messing up. So please correct me.
So I'm a board-certified plastic surgeon. So as a board-certified plastic surgeon, my job is to give the options for breast cancer reconstruction to the patient. So that could be anywhere from just putting in implants after a mastectomy all the way to doing what we call a deep flap, which is a tummy tuck breast reconstruction. And so really and truly, that's really what we specialize in, is doing this tummy tuck breast reconstruction.
Okay, so let me welcome to the show, ladies. Go ahead and say hello.
Hello, we're happy to be here. Hi, everyone.
So if I could back you up just a little bit, Dr. Ambay, because, for the person listening, even somebody like me that's never had breast cancer, thank goodness. I have had 2 breast masses removed. They were both benign, thank goodness. But for somebody like me, and maybe even the person listening that really doesn't even understand like how or where this might start, Michelle, I'd really love to start the show with you. And if you could back up and just talk about your story, talk about like where you started, how you found out, because I imagine before that time you're probably bopping around like the average person listening, and then one day you have this big surprise you have to deal with. So will you jump into that and talk to the person listening and explain what that was like for you?
So I was 32 years old and I had a chronic ovarian cyst on my right ovary, and it continued to come back and rupture and come back and rupture and come back and rupture. And I finally went to my gynecologist and I said, listen, something has to give. I can't deal with this any longer. What can we do? And she said, well, Michelle, talk to me.
Was that pain for you or what?
Oh, yeah.
Okay.
It feels a little bit like something when it ruptures, like there's a little explosion in your abdomen. And just bloop. And it can be very crippling in terms of pain. I went into my gynecologist and I said, we have to do something about this. It was recurring for me on a monthly basis. And she said, Michelle, talk to me about your family history. And I said, well, my mom's side is fine. Mom's perfectly healthy. She's never had any instance of any sort of reproductive cancer at all. And she said, well, I don't think that your dad's side can be applicable, but let's talk about his side anyway, just in case. And I said, well, Dad's healthy. We know that my grandmother had some sort of reproductive cancer and that my great-grandmother died of some sort of reproductive cancer, but their medical records have been destroyed at this point. So we're not really sure what they are. And the doctor at that point said, maybe we should do a BRCA test. It's BRCA1 and 2. It's a genetic screening for genetic mutations in either of those genes. She said, so let's do this test just in case. And I said, okay, sure. I didn't think anything would come of it. Turns out that my genetic mutation came from my father's side, and that I have a BRCA2 mutation. My mutation is something called a mutation of unknown significance. I am person number 13 in the known diagnostic category with my specific mutation. I went and sat with a doctor who did the sequencing of the gene originally, and he said, Michelle, if you were my daughter, looking at what this mutation is and where your substitution is, I would suggest that you treat it as though we know that it's a problem, and let's go ahead and take care of it. But in that very moment where that piece of paper came to me and said, here is your mutation information, the nurse handed it to me, and she turned around and walked out of the room.
And you're going, what does that mean?
What does it
That's
mean?
what I would think as a person of a non-medical background.
What am I doing? Where do I go from here? I knew what it was, and I knew what it meant in that moment. And I knew that that was an anchor point in my life, because suddenly I had this fight that was coming to me at some point. It turns out that my numbers are sitting somewhere in the 87% mark. The risk of me developing breast cancer over the course of my lifetime was approximately 85 to 87%. We knew that the fight was coming. It was just a matter of when.
So how old were you when you first encountered this and got the paperwork and did the test?
I was 32 years old. I had 2 children, a boy and a girl. They were, at the time, they were 9 and 8. And so I was 32. What do you do at 32 when suddenly your doctors say, oh yeah, you're going to have breast cancer. You're probably going to have ovarian cancer over the course of your lifetime. Have fun with that. See you later.
What do you do, Dr. Ambay? Like, what advice do you give somebody that's looking at that? Like, what do you say to that?
It's a very difficult situation, and really the only thing that you can do is you can sit down with them, you can tell them about your experiences, you can have some compassion for what each person is going through. But more importantly, you have to provide information in small doses, and then have a system of a regular follow-up, because when they find this information out, it is like the world just went black on them. And they're not really listening to everything you're saying. They're listening to probably every third word you're saying. And so the first thing is, telling this to somebody who's alone is probably not the best way to go. So you want to get them back in with somebody who will listen, who will take notes, and then give them the information that answers the immediate question, and then have them come back a few times, because otherwise it's like getting information like drinking through a fire hose.
Right. So typically that person would be a spouse or a parent or something like that, right?
Yeah, exactly. Just even a good friend. It's fine, but whoever it is, they just have to be someone that's going to stick by this person.
So, Michelle, at this point for you, you got this information that said, hey, you're going to have cancer at some point, but you don't right now.
Mm-hmm.
And then at what point has that progressed, or did it for you?
So I went ahead and decided to have a prophylactic ovary and tube removal. I had previously had a partial hysterectomy because of an infection, so I still had my ovaries and tubes. And we knew that because of my grandmother and my great-grandmother's family history, that was my area of most concern. So at 32, I elected to go ahead and have those removed. Hit menopause at 32, running full tilt into a wall. But we discovered when the pathology reports came back that I had significant cellular changes in those tubes, that it was coming, and it was coming rapidly. So that was my first decision, and that was absolutely the most important decision for me. And then relatively immediately after that, I went through my mastectomies and began the reconstruction process.
So let's break that down just into the simplistic form, if you don't mind. That's essentially where you have breast cancer, and then for medical reasons, right, Dr. Ambay, the breasts actually have to be removed. Is correct?
Correct. I mean, there's a spectrum of choices that are available, but in this particular circumstance, she opted for a mastectomy and opted to have both her breasts removed.
Mm-hmm.
And why would that be? Why would someone make that decision versus over one or both? Because I've heard that.
For me, it was prophylactic. I was having them removed ahead of cancer, before a diagnosis. some of your readers or your listeners may be familiar with what Angelina Jolie did several years ago. She went through essentially the same thing that I've done, where we elected to have our breasts removed ahead of a cancer diagnosis. My breasts were perfectly healthy at the time, but I knew going into my late 30s and my early 40s and my 50s that at some point it was likely going to cause me a problem. So I had them removed ahead of time. And I went through what is usual in terms of reconstruction. I had tissue expanders, which are sort of like hard balloons implanted, and those were expanded with saline over the course of time to expand the tissues. And then we exchanged those for implants, which are regular saline or silicone implants, like you would see in just a breast augmentation. In my instance, I had an autoimmune reaction to the tissue that they used to hold the implants in place, and I had to have it all taken out. I had that done 2 years ago in January, and I was flat for 21 months. I had nothing up top until Dr. Ambay.
So talk about how, like, when you make the decision to actually remove it because you know it's coming, does that help, like cancer from spreading in different places? Can you talk about that from a medical standpoint?
Well, there's really two stages. I mean, the first stage is you have to deal with the cancer itself. So that's the first part of it. And that dealing with the cancer, as soon as women find out they have cancer, now, with Michelle, she didn't have cancer, but she was still a ticking time bomb. That being said, the first solution is, let me just get it out of me. Whatever that is, let's just get it out of me first so I can take a breath. Once that happens, the next step is, well, I'm not whole anymore. I don't feel real anymore. I'm not a woman. And I frequently see women go through this. So the second step now is, okay, now how do we make them feel whole? Because the idea here is we really want them to just turn the page and move on. So we do take this in two separate steps.
So with you having that allergic reaction and basically you had to redo it again with Dr. Ambay, tell me about that process. Like, how long has it been? How is it now?
So I waited 21 months between the time that I was deconstructed with the implants and the time that we did the deep flap. Most of that time, I didn't think that I was going to ever go through reconstruction again at all. It wasn't until May of this year that I discovered that Dr. Ambay was even in Florida doing what he does, and we had a consultation in May. And I made the decision that I trusted him. And then I went through the deep flap with him in August.
What does that mean? Can you explain that, what a deep flap is?
Dr. Ambay would probably be best in terms of technicals, but essentially what he did was took all of my leftover mom fat and took it from across my abdomen where my C-section scars were. So he took everything from right above my belly button right down to my pubic line, and then moved it all up and formed breasts.
So medically speaking, well, the first thing is that I met Michelle after she had her reconstruction with another plastic surgeon, and then because of the autoimmune process, it failed. And at that time, the plastic surgeon said, "Well, there's really no other option for you, so you should look for someone who does this procedure." And the problem is there's probably less than 3 people or 4 people in the state of Florida that do it because of its complexity. But breaking the whole thing down, I really searched to try to think about what exactly I should call this so that people understand it. So the technical term, we say deep flap, DIEP, but that's deep inferior epigastric perforator free flap. That's a long, tough word. So now we just said this is going to be a tummy tuck breast reconstruction, because everybody understands that a tummy tuck is taking all the tissue, all that mom fat that everybody hates, right, and is willing to donate, and then doing something constructive with it. So what we do really is we take this tissue and we dissect the blood vessels out of this excess tissue that's usually just thrown in the trash. And then we dissect all the blood vessels out. We take that out carefully. Then I make a breast on the back table with just the skin and the fat. So the key here is we use no muscle whatsoever, only skin and fat. I make a breast out on the back table that fits the breast that was removed at the time of the mastectomy. And then we put it back into the chest, and under the microscope, we hand sew the artery, the vein, and the nerve back into place. So it's literally a tissue transplant for tissue that's normally thrown in the trash. The consequence of all of that is that they have a natural feeling breast of their own tissue that will never get cancer again, and we use tissue that they are so glad. So the side effect is you get a tummy tuck out of it.
So Dr. Ambay, we're going to talk about this a little bit more and talk about how the heck you discovered all this, and then we'll bring Florida Hospital in a little bit later to talk about some of these rock star doctors they have, like Dr. Ambay. We got to take a break. We'll be back in just a minute. Ask me about an inside secret to save several hundreds of dollars on your annual homeowner's insurance premium. Text the word WIND, W-I-N-D, to 813-377-2775. Again, 813-377-2775.
Are you suffering from IRS problems? Do you owe back taxes you can't pay? Is your paycheck or bank account being levied? Or maybe you haven't filed tax returns in years and simply don't know what to do. This is Darren T. Mish to tell you that if you're tired of IRS problems hanging over your head and are ready for a fresh start, we may be able to help. Call the law offices of Darren T. Mish at 888-GET-MISH, 888-GET-MISH. I can help you file old tax returns, work to release tax liens or stop wage levies, even negotiate deals to pay off back taxes at a discount, sometimes for pennies on the dollar. Hey, let's face it, these days it's not hard to get into tax trouble. A divorce, failed business, health problems, you name it. The point is, IRS problems may be solved if you're willing to take the first step. Call for a free consultation at 888-GET-MISH. That's 888-438-6474. Or go to the web at getirshelp.com, because the one sure thing is, IRS problems don't solve themselves. So get MISH. 888-438-6474. Principal Office, Tampa.
Welcome back to the show. I'm your host, Katrina Madewell, and you're listening to Tampa Home Talk. And before we took a break, we got into some really advanced stuff that's like Dr. Ambay can do in a sleep. We're going to have to recap that just real quick in a minute. And I want to correct myself because Dr. Ambay actually has hospital privileges at Florida Hospital, but he is with Advanced Breast Reconstruction Specialist. Thank you for correcting me.
Thank you, Katrina.
So, back up just a little bit and talk about this procedure, and then we're going to have Jen chime in after the next break because Florida Hospital is playing a pretty profound part of some of the surgeries that you're doing here. So I take it you're not from the Bay Area, right?
No, I'm actually, I was trained at the Mayo Clinic in Rochester, Minnesota, and then I did a fellowship and advanced training in breast reconstruction at MD Anderson Cancer Center. I did some breast cancer research at the National Institutes of Health through a physician scientist training program. And I actually came to the Bay Area here because of my military service. And then
thank
when
you
I
for
came,
serving.
Thank you so much. And so when I came here, I thought this is a great place. And of course, my wife thought it was even a greater place. So I just listened to her, and it works out.
It always works better when you do it that way, Dr. Ambay. I'm just saying.
Yeah, you learn the hard way, but you still learn.
So, what made you want to go into this line of work? Because being a doctor is so specialized if you're going to be good at it, right? The riches are in the niches, they always say. So the specialized field of medicine is, the more you know about one particular thing, the better you're going to be at it, right? Am I correct in saying that?
Yeah, I think that's absolutely correct.
So what made you choose this particular field to help somebody like Michelle, to help people like, we were talking to Jen on the break with your mom that has kind of the lopsided knees, right? That's what I call them, knees. That's what we called them when my kids were young and we nursed. So when you have the lopsided knees and you say you have to fix that and that's easy, back up and just talk about because what you're doing here is a lot different, and definitely share where you had to go before and all that stuff. So you were saying that you literally, before, you guys would put in the saline implants. Talk about before and what you're doing now that's different, because that's way over my head.
So I think that first of all, having a niche surgery is something that it gets developed over time. I can't really take the credit for developing it, but I did learn how to do it over and over again, in both at the Mayo Clinic in Rochester and also in Houston, Texas. But really, I think the reason why I went into plastic surgery in general is that it is a field in which you have to be kind of MacGyver-ish. So there are procedures with general surgical principles that you have to follow, but then you get to be a little MacGyver-ish and artistic in how you put things together. Secondarily, I was in the military, and I was in Afghanistan and Iraq, and I was with the Special Forces. And during that time, you have to be MacGyver-ish. You have to put things together. You have to do trauma in the field. You don't have the equipment that you'd normally use, but you still have to have a good outcome, and you have to help those soldiers. So when I came back home into my civilian career, I wanted something that would reflect all of that. And so as I came to Tampa, I realized that nobody in Tampa was really doing a true deep flap, taking no muscle. And really and truly, the pain that people feel in breast reconstruction is because the muscle is taken. So the choices are, in Tampa currently, is that if you decide to get an implant, then they have to do the mastectomy and they cut part of the chest muscle and put the implant in underneath the chest muscle. So you have to cut the chest muscle, and if you can imagine, when you stretch and you exercise, and you stretch your muscle to the point where it hurts, and then somebody stretches you much more until your muscle tears, that hurts a lot. And so that is why people who have breast reconstruction hurt. And so the first method of breast reconstruction is going to be this implant-based breast reconstruction. The other things that has been done in the past is they take the muscle from the back. So that V-shaped muscle, that bodybuilders create, that V, or that you would use for rock climbing or a pull-up, they actually take that muscle and cut it and bring it to the front of the chest. And then the more traditional way of doing it is to take both the stomach muscles from the abdomen with the tissue in the lower abdomen and swing that up into the chest cavity, which basically means now you're cutting both stomach muscles. So if you think about it just in a very simplistic way, you have your back muscles in your back and your front muscles in your front, and they balance each other off. The minute you lose your two front muscles, you've created an imbalance with this patient. And even if they're young and you do it and you say, well, there's no adverse effect, there is an adverse effect over time as they age, and they need all their muscles to even get up out of a chair.
Where it has to be you're moving stuff around inside your body.
Absolutely, no question. So what we said is, well, how can we do this without using the muscles? So we spare all the muscles and we dissect the blood vessels, very tedious dissection, just taking the things that we need and sparing all the nerves and everything, so that we not only can use the tissue from the abdomen, but then when we work with a breast surgeon, and we work with Dr. Michaela Klein from the Florida Medical Clinic at Florida Hospital Wesley Chapel exclusively. And we developed this team at Florida Hospital Wesley Chapel to be able to have a team that is the same team all the time to really maximize your outcomes and to reduce efficiencies and reduce the fact that you get teams switching in and out that really don't know what this procedure is about. And so at the end of the day, what ends up happening is we put together this phenomenal team of people. And even in my own practice, the advanced breast reconstruction specialist, we fly in two other surgeons, one from Houston and another one from Connecticut who is at Yale. And we fly in and we have three surgeons working on one patient at the same time. So we reduce the anesthesia time. Everybody is a board certified plastic surgeon who knows microsurgery, which is really how we do the connection of the blood vessels underneath the microscope. And we increase the outcome and decrease the pain.
How long does something like that take, especially with three of you guys that are all microsurgeons? How long would it take to rebuild somebody like Michelle when you're doing this D-flap procedure?
So it's patient dependent, but we usually tell people, 6 to 8 hours. Sometimes it goes to 10, and sometimes it's less than 6.
So this is still an all-day thing, no matter how you slice it. Even with three doctors, this is an all-day thing.
Yes, and it's just a very tedious operation that requires just a lot of patience, and it's really not something that you can rush through because you're trying to save every muscle and nerve that you can, every muscle fiber and every nerve that you can save. so that at the end of the day, when we do it with Dr. Klein and the mastectomy, we actually leave a patient for the first time with a breast that's fully sensate, which means they have sensation on their breast and breast skin.
So now that you've explained this so well, like what some of the options are and what you guys are doing, can you re-explain what you said before the first break? So you literally take some of the stomach fat and you pull it out along with the nerves, and you're recreating a breast under the microscope with a nipple and everything.
Yeah, so in short, what we end up doing is we take tummy tuck tissue that's usually thrown away, and where they just cut through those blood vessels. It's just skin and fat, and it's usually thrown into the trash. Well, that's what's done in a cosmetic surgery. So what we do is we apply those same principles, but here we dissect the blood vessels out very, very carefully. And then once we dissect them, we take that entire fat and skin tissue along with the blood supply. We take it to a back table. We then just mold it into a breast so that it fits perfectly into the breast that was taken at the same time that it's being taken. And then we put it into the chest, and then we hand sew the artery, the vein, and the nerve underneath the microscope. So you need 2 surgeons to do it. So now what ends up happening is you go to sleep, and you've had your original breast, you wake up, and you have breasts the same size, completely reconstructed.
So you're getting, and as opposed, this is like all in one. Am I understanding that correctly? So you're getting the breast tissue or whatever that was in there before taken out, and then you guys are actually reconstructing everything under the microscope and putting it back in before they leave. This is all being done in one day?
Correct. Everything is done in one day with the side effect of a tummy tuck.
Wow.
And I think the really telling part about this whole thing is that if you go online and you look at the posts and the blog of people that have had breast reconstruction, people talk about being down for 6 weeks and being months and months and months before they feel like they're themselves. And then we have this surgery where the next day, including the mastectomy, people are on Tylenol. They can walk upstairs the second day and they go home the third day. They can drive by the end of the week, and I think the outcomes just speak for themselves.
And the difference is you're not tearing and ripping and moving and pulling that muscle, right? It's still there in place?
That is absolutely the difference. People can call it the same procedure, but really the question our listeners should be asking when they go in for their consult and someone says, I do a deep flap, is, do you take any muscle?
Good question. Thank you. That's a great question that somebody like me would not know what to ask. What else should someone be asking?
They should ask for the experience of the individual, because far too often you get a plastic surgeon who is working with an ancillary provider, and what you really need to do is you need to have a dedicated team of people who do this all the time. And you need to have a hospital that has built their resources around there. So we have worked extensively with Florida Hospital Wesley Chapel. We have a record of successes, and the hospital and the leadership, all the way down to the nurses, have all committed resources to doing this right, and that's the difference.
It makes sense to me why you guys have grown so much. We have to take a real quick break because we're at the bottom of the hour, but when we come back, we're going to talk about, I'm sure you have a couple more questions you should be asking, so we're going to slide those in there, and then we'll jump on over to Jen and talk about Florida Hospital's position and how and why you guys are doubling, but we just heard that from Dr. Ambay, so we'll be back in a minute.
You've heard this before. Interest rates are at all-time record lows. But if your interest rate is 4% or above, you owe it to yourself to call Silverton Mortgage Specialist. Silverton is a direct lender, and the best part about this is that the entire loan process is handled in-house. From application to close, we do it all in the same building, which means that our loans close fast and our clients know what's going on every step of the way. Our contact info is located on TampaHometalk.com under Radio Show. What makes Silverton different? Products. We offer VA, FHA, USDA, and conventional loans pricing. Best rates with the lowest closing cost. Process everything in-house. It's handled right here and not outsourced to anyone that no one can reach. This way we can avoid surprises. Our people are simply the best, and we know you'll agree. What will closing Silverton Mortgage Specialist mean to you? A smooth process, real home loan value, and personal attention from real professionals. Silverton Mortgage Specialists are here to serve you. Visit TampaHometalk.com under Radio Show for all of our contact details. NMLS 109600 is an equal housing lender and Florida and Georgia residential mortgage licensee.
Curious what your Tampa home is worth? Here's an easy way to find out what homes like yours are selling for in today's market. Text the word value to 813-377-2775 for a free report on Tampa house prices. We'll send you a free report with up-to-the-minute statistics based on all homes for sale sold in your neighborhood over the last 6 months in all price ranges. To get your free report on Tampa Bay house prices, just call or text the word value to 813-377-2775.
Aaron Davis here, owner of Hillsborough Title, serving all of Tampa Bay. Our service, strength, and knowledge make us different. From Polk County to the Gulf, Pasco to Manatee, Tampa Bay, we've got you covered. Visit us on the web at thebesttitle.com. That's thebesttitle.com.
You're buying a house. Congratulations. So while you're worrying about the paperwork, leave the moving part to us. We're Woody & Sons Moving Company, a Florida licensed and insured mover, and we offer same-day written estimates. Plus, no sneaky mileage, stairs, or additional stop fees. All we ask is that you check out our great ratings on Google and Angie's List, then go to woodyandsons.com to learn more. Whether you need a full-service pack and move or some extra hands, at Woody & Sons Moving Company, we move you.
So, D-flap, right, is the name of the procedure?
That's right.
Okay, so just to recap from the first segment, and please correct me if I get anything wrong, some of the questions that you should be asking your doctor is experience level, how much muscle they're taking, if any, right?
They shouldn't take any muscle. In a pure and real deep flap, you don't take any muscle at all. You only use the skin and the fat, and that's it.
And then what are a couple other questions you should definitely ask anybody before they perform the surgery? Or really, you should be interviewing your doctor, right, at this point, and asking them questions that, that matter and how your recovery period is going to go.
Absolutely. You get, the thing is that you really get one really good shot at doing this right. This is not something that you can do again once the cuts have been made by somebody. So once somebody else has cut into the abdomen, I really can't do this flap any longer. So the questions are to ask is, do you take any muscle? That's the first thing. Because if they take any muscle, then that's not a deep flap, even if it's been called a deep flap. The second thing is, what are their experience level? That means, do they have a dedicated team of people doing this operation? The third thing is, where are they doing it? And is the team at the location that's being done dedicated? Like for us, it's at Florida Hospital Wesley Chapel, a dedicated team who it's the same people all the time. And then the final thing that they should be asking about is the experience level of each of the surgeons that are going to be involved in the case. When this deep flap is done right, traditional breast reconstruction, they put in mesh. Mesh is an artificial substance that's put in. They put it in the belly. They can put it in the chest wall when they do the reconstruction. However, when you do this deep flap, it's 100% natural. We don't use any mesh, not even to close the abdomen. So I think all of those things combined is really what leads to the outcomes that we have seen.
How many people in the country do what you guys do? Probably not many.
It's done by less than 2% of plastic surgeons nationally.
That's what I'm thinking.
And in Florida, there's probably 6 or so people that do it. And in Tampa, we're really the only private group in Tampa that does these cases right now. I think all the way down to Naples.
And so, Dr. Ambay, the name of your group is Advanced Breast Reconstruction Specialist, and we will post all this information up on Tampa Home Talk. So I know a lot of times the people listening, they get a lot of information. Most of our persons listening, they already know we're at Tampa Home Talk. So we will post this on our site, on our Facebook page, on our Twitter feed. Right, Jody? So Jen, Talk about
Yes.
Florida Hospital's position in this, because you guys have grown by leaps and bounds. I mean, I live in the area. This hospital went up like, bam, overnight, just like the mall, right, that opened today. And then now, all of a sudden, boom, you guys are doubling the size of your facility in less than, what, 2 years, 3 years?
3 years ago, Florida Hospital Wesley Chapel opened its doors, and yes, we are growing, we are expanding. The community is telling us the need is there, and we are very excited about the expansion. We broke ground, $78 million of an investment. We're going to have new emergency rooms, patient rooms, operating rooms, and more. And on a personal note regarding breast cancer, get your mammograms. We have 22 hospitals across the state of Florida. Florida Hospital Wesley Chapel does not sleep 24/7. We are there to get your mammograms, get screened. Early detection is key.
Now, I know in this day and age, everyone's supposed to have insurance by now, right? But if for some reason someone doesn't have insurance, is there any type of a community day that you can do for like the cash pay people that want to get a mammogram? Is Florida Hospital doing anything like that?
We have so many programs. Check us out online. Florida Hospital, it's fhwesleychapel.org. You can find information. We have a Florida Hospital Foundation that has different information and help for people in the community. We have free events. I can't even count how many events we have across the West Florida region. Our 9 hospitals, free events for the community. Wesley Chapel just had an event recently at Saddlebrook. More than 800 women came out, and I believe we had screenings there. There's always something happening, and it's good food, it's fun. Get out there, get screened.
And so I'll talk about my experience at Florida Hospital because we've been there. I have 3 kids, right? Somebody is always in the ER for something. If it's not, my son had this little remote control car, and the little ball that's on the end of it came off, and he grabbed the wire, and when he did, it like a fishing hook wrapped around the tendon on the inside of his thing. And so we were at a birthday party for him and my husband because their birthdays are 3 days apart. And a couple of our good friends are firemen, and they're like trying to hook it out, and they saw something. They're like, and I saw that look on their face. I'm like, yeah, we're taking them to the hospital. So, the time just to get in and out and the doctor care was really good, just by somebody that doesn't have any affiliation with your hospital. And I just want to give you guys kudos for that.
Well, we are so glad to hear that. I had a personal experience myself with my son. We took them ice skating, and of course he fell the first time and hit his head. And we took him right to Florida Hospital Wesley Chapel with Dr. Michael Longley. We got right in and out. Everything came out well, thank God. But you just never know. When emergencies happen, we're there, we're ready.
And the people are awesome. I was telling you a little bit about Dr. Jonathan Phillips because he does a lot of sports medicine. I tried to hook him in as my primary care a little bit because I rarely go to the doctor almost ever. But, we have cheerleaders, baseball players, all these kids in my family that do something sports related. So the likelihood of them having some kind of sports injury, because we're all so active, is pretty good. So Dr. Phillips was so great. I mean, these doctors that you get from all over, like Dr. Ambay, I don't even know where you get these guys, but they do such a good job.
They're amazing. Our physicians are quality, excellence, compassionate care, and it's all about the patient. They really do care. It's customized patient care, and that's why we're growing. I mean, we have, you can't believe it, just 3 years. Florida Hospital Wesley Chapel has been open, and now construction has already started.
I was thinking it's been a year.
Is 2016. So
I had no
really
idea
exciting.
It's been 3 years. That's how jaded I am driving around the same place seeing it. So Dr. Ambay, this is an example of what I'm talking about. You said you were doing this same surgery. You'd have to literally go to Texas to do this.
Yeah, for the last few years, we had been patients would come to me because, the one thing about breast cancer patients, like Michelle, is that as soon as they find out they have breast cancer, they become incredible advocates. They are not the same person that they were before they found out they have breast cancer. And it is amazing, how passionate people like Michelle are. So in 2 years ago, when I started trying to do this in Florida, I had a lot of people that said it couldn't be done. But I knew it because I had done it before. So what we were doing is we were getting patients from Tampa, flying them to Texas, where my other partner is, and then we would do them together in Texas. But then when Florida Hospital Wesley Chapel came by, the door opened up for us. And that made a tremendous difference. And I got to meet people like Michelle. And honestly, I mean, I think that she talks about how breast cancer has changed her life. But I will tell you that every time I meet someone like Michelle, it changes mine too.
Absolutely. Absolutely. I can relate. I host a radio show for fun, but my real job is selling real estate. And, there's a lot of value that comes in home ownership to people. And so as long as I've been doing this, Dr. Ambay, for 22 years, I still get so much joy in helping that, everywhere from the young first-time home buyer in their young 20s to couples 50, 60 something buying their first home, or moving up. There's a lot of joy in that. Or people send their kids, that kind of stuff. So we're going to take another quick break. Sorry. We'll be back in just a minute. We're going to talk about some of the great facilities and other things that you guys have there because you're not just a hospital. And then we'll do our little lightning round. You guys can chime in on anything you like. We'll be back in a minute. Hey, Katrina Madewell here. Just wanted to make sure you know how to reach us on our off-air number. If you'd like to connect with myself or any of our guests, you can call us at 813-377-2775. Again, this is Katrina Madewell, host of Tampa Home Talk, and to connect with myself or any guests we have on air, just call or text at 813-377-2775. 813-377-2775.
Are you suffering from IRS problems? Do you owe back taxes you can't pay? Is your paycheck or bank account being levied? Or maybe you haven't filed tax returns in years and simply don't know what to do. This is Darren T. Mish to tell you that if you're tired of IRS problems hanging over your head and are ready for a fresh start, we may be able to help. Call the law offices of Darren T. Mish at 888-GET-MISH, 888-GET-MISH. I can help you file old tax returns, work to release tax liens or stop wage levies, even negotiate deals to pay off back taxes at a discount, sometimes for pennies on the dollar. Hey, let's face it, these days it's not hard to get into tax trouble. A divorce, failed business, health problems, you name it. The point is, IRS problems may be solved if you're willing to take the first step. Call for a free consultation at 888-GET-MISH. That's 888-438-6474. Or go to the web at getirshelp.com, because the one sure thing is, IRS problems don't solve themselves, so get MISH. 888-438-6474. Principal Office, Tampa.
Aaron Davis here, owner of Hillsborough Title, serving all of Tampa Bay. Our service, strength, and knowledge make us different. From Polk County to the Gulf, Pasco to Manatee, Tampa Bay, we've got you covered. Visit us on the web at thebesttitle.com. That's thebesttitle.com.
Welcome back. You're listening to Tampa Home Talks. Thanks for rejoining us. I'm your host, Katrina Madewell. We're in studio today with Michelle Hall, Jen McVan, and Dr. Ambay with Advanced Breast Reconstruction Specialists. Thanks so much. Welcome back to the show. Where we left off before the show, Jen, you were talking about some of the great things you guys have because you've got a whole fitness center and a whole bunch of stuff going on over there.
Florida Hospital Wesley Chapel has an amazing health and wellness center, free events all the time. You just have to go online. We'll give that information. Michelle and I were talking about some of the cooking they've got going on there, healthy foods and exercise classes. And then, of course, we have a monthly breast cancer support group that happens at Florida Hospital Wesley Chapel. That's free, that women can come and just be together and share their stories and really get support from the community.
So, Michelle, chime in on that because, my cousin right now has leukemia, and this is like the first time our family's really experienced something like this with somebody very close. And I remember her saying that the support group has been huge for her.
I think, now I don't participate in the support groups in Wesley Chapel. I live in Lakeland, so it's a little bit of a drive for me.
Right, but Dr. Ambay was talking about how you're an advocate and how this changes you.
I'm certainly not the same person that I was 2.5 years ago, by a long shot. I work with a nationwide organization. It's a not-for-profit called Bright Pink, and our goal is to educate young women about breast and ovarian health and things that we can do before a cancer diagnosis to make sure that our health reduces our risks as much as we can. So I talk to young women all across the state. Right now I'm working with Zeta Tau Alpha, a sorority at most of the Central Florida colleges. I've spoken at Florida Southern, and I was at UCF yesterday. I'll be at USF later in the month. So I spend my days and my volunteer time going out and talking to young women, encouraging them to get to know their breast health make sure that they understand that they should be talking with their doctors early about their breast health and their ovarian health, and making sure that they're as healthy as that they can be.
At that age, people think they're invincible, right?
Absolutely.
We were all in our 20s. You remember that.
I'm still there.
That's what I'm thinking. But, that experience goes hand in hand there, Dr. Ambay, so you can't make yourself too young.
It's my goal to encourage them to understand that what they do now in their late teens and early 20s really has an impact on their future breast health and their future ovarian health.
Give me something for an example.
For example, did you know that if you took oral contraceptives for 5 years in your 20s and 30s, you can cut your risk of ovarian cancer in half?
Really?
Yep.
So it has to be oral, can't be like the Depo-Provera injection?
There is some science trying to figure out why, because we're not 100% sure why it reduces your rate so much, and whether or not that science shows that things like Depo or the implant in your arm also reduce your rate is still in the works. Right now, that we know that the oral contraceptives cut that risk in half.
Is there anything that increases the risk of breast cancer or ovarian cancer?
Things like smoking.
Okay. Anything else, Dr. Ambay, you can think of?
I think that family history is probably the number one thing. So not everybody has to have the mutation, but it does increase the risk.
What happens with somebody like me that literally on my birth certificate it says father unknown? What in that situation?
Well, there is some genetic testing involved, but it's really the maternal side, your mother's side, and your sisters, and that really determine your breast cancer risk.
Anything else you guys like to say to close the show, because it's wrapping up fast?
Thank you so much for having me. I appreciate it.
Jen?
Thanks for having us. We want you to look at our inspired health across Tampa Bay. And sitting here with Dr. Ambay and Michelle, that's what Florida Hospital is all about.
Thank you for being a valuable part of the community. Dr. Ambay?
If you need more information, just go to Advanced Breast Reconstruction Specialist or breastreconstructiontampa.com. We're going to have a new website that's going to come up, and you can actually see and hear about Michelle's experience and the experience of other breast cancer survivors.
Yay. And they're different. I can feel it. Being in the studio with you guys, I can just feel it. I'm a very good sense of character. My name's Katrina Madewell. You're listening to Tampa Home Talk. We're so happy to bring you a show this week on breast cancer awareness. If you miss any part of the show, you want to catch up with these guys, you want to catch up with Michelle and talk to her, or Jen or Dr. Ambay, we'll hook you up. Hop on over to TampaHomeTalk.com and we will put all their information on there. Thanks so much. We'll be here the same time, same place next week. For this week, we're out.